Welcome to today's plan and recap. Our patient has had a partial denture and she really hates her teeth. She's got a deteriorated set of teeth, but she started on a plan where they were going to build up the bone and build up the gum and try to get individual gum-fitted restorations. But what's actually ended up happening is all the gum has receded wherever she's had the bone graft, and you can't actually see any good gingival choreography to enable us to put individual implants for an FP1 type of restoration. So we also, when we look at her gum display, you can see that there's some gum showing, but over here there's an excessive amount of bone graft which pushes the lip out and which she really hates. When we look at the x-rays, you can see that the zygoma bones have they have reasonably good width, but they're poor density on the inside. So that's something to be aware of. And sometimes when the zygoma bone, even if there's a lot of bone there, if the density is poor, then sometimes the stability is not great, even of the zygomatic implant. If we now look at the panoramic, you can see on the panoramic view that her sinuses are extending quite low, and once we remove the teeth, it's essentially going to create a hole into the sinus. And there's not going to be any support there for the zygomatic implant. So this side is going to be a sinus crush. And then on the in the front, you can see the sinus is extending very far forward. So we're planning to put a trans sinus implant there. It's going to go, usually a trans sinus implant goes in this direction, but in this particular case, it's going to start from the canine and anchor into the piriform area. There's only one spot to anchor it into because there's not a lot of bone in there at the moment. So we're going to graft this whole area and we're going to use a transsinus implant in there. We're also planning to put a midline implant, and then we can use this graft that she's already got in the 2-3 side to put an implant into that area as well. Now for the left zygomatic implant, you can see that she's got a graft, a sinus graft already present. So that's great because we've got some additional anchorage there through the sinus when we position the zygoma implant. If we now look at the transsinus implant that I'm planning to place here, you can see that the tip of the implant is going to be anchored into this piriform bit of bone, this triangle of bone. So there's not a lot of it in here. And then the collar of the implant is going to start from the canine side. So it's going to go on a bit of an angle from that canine through the sinus and into to anchor into the piriform triangle. But you can see even on the cross section how far the sinuses are extending, almost well, right up to the roots of the twos. This is the 3 and it extends all the way to the roots of the twos. So there's really not a lot of bone to anchor an anterior implant. And the plan, because we're using a transsinus implant in that position, I also want to put a midline implant to give that additional support in the anterior area. But when I set out to do the midline implant, I put it into the nasal spine, and what I found, the bone was very poor and the whole thing fractured. So I was unable to get good stability in the midline. So I had to move this implant off center and put it in the 1-1 side. So you can see it's orange because it wasn't the planned position. It had to be moved from the originally planned midline spot. You can see the trans sinus implant that goes, anchors into these 2 areas, and then you can see the delineation of the sinus floor extending all the way to the lateral side, and then we had to do a sinus crush in order to be able to get the required restorative space and in order to position this zygoma implant. And because the bone quality of the zygomas wasn't great, I also placed an additional pterygoid implant, and I did that on both sides in order to get that additional support in the back. And the reason I chose to do that was simply because the bone quality in the zygoma wasn't great, and combined also with the sinus crush procedure, overall the risk factors are higher, and that's why I decided to add the additional pterygoid implants. And that's her finished result. So she's ended up with a very nice looking restoration, and she's got a beautiful smile now. And if we go back to what you originally set out to do by trying to preserve the bone and build up the bone and do FP1 type of restorations, there is no way in this type of case that you would be able to achieve this type of results when we are trying to use individual implants. Thanks for tuning in. See you guys next week.